Hello learner, today we are going to discuss about the risk factors of heart diseases wherein in each disease, if you would have seen with which we have started, the risk factors, okay, the symptoms, then the prevention management almost goes similar. So I have uploaded a separate video on risk factor, symptoms, prevention and management, okay, which will compile a common answer for all the heart diseases approximately, okay. So this basically comes under etiology. It is nothing but logy is to study and etio is something to deal with the causes of that particular disease. So this, what is the difference basically now between the cause and the risk factor? Cause is something which you can be sure of that yes, this is the cause of this particular disease, and then risk factors are basically, they are the similar terms, but risk factor about it is one of the factor we cannot be sure of, but it is a potential factor, and the cause is something about which we can be very sure. So we are going to discuss the common risk factors of heart diseases. Basically, before going to the risk factors of the heart diseases, we will first study the causation pathway of cardiovascular disease. That means what is a general scheme for development of cardiovascular disease. Like there can be two things, okay, wherein you can see the genetic predisposition can be there and socio-cultural factors can be there. That means like basically the genetic factors which we cannot control and the socio-cultural factors we can control. Like for example, the physiological factors like obesity, okay, this obesity, dyslipidemia, hyperglycemia, hypertension, okay. So this is what this basically like means we can control this obesity and all with a bit changes in our lifestyle modification, like if we go for physical activity, okay. Then dyslipidemia, like it is lipid, deals with the lipid content, so again nutrition plays a role. Then hyperglycemia, okay, hyperglycemia is again we can control our diet, okay, and some regular exercises, that is increase in the sugar level, okay. Then hypertension, again we can control it through the our daily day-to-day routine life, okay, controlling the stress, controlling the bad habits such as smoking, alcoholism, etc., okay. So this eventually these all factors cumulatively will lead to endothelial dysfunction and eventually cardiovascular disease. So this is a general pathway, so wherein we are going to talk about the risk factors. There are basically two types of risk factors are there. Modifiable risk factors, that is controllable risk factors also you can call them, and few are non-modifiable risk factor, that is non-controllable risk factors also you can call them. So what are they? If you will talk about the controllable risk factors, as you can see in the picture, okay, first we will start from the tobacco or cigarette smoking and all. So it is nothing but this cigarette smoking or tobacco chewing, this is one of the risk factor which we can control or which we can modify it through our habits, okay, through change in our habits. Then if we go towards the unhealthy diet or overweight, obesity, like overweight and obesity we can definitely control through our diet. If we will control unhealthy diet, that is basically if you will see in inbuilt body में भी fat generate होता है through different metabolic mechanisms, and through our diet also, like eating very unhealthy food, junk foods, etc., very fatty food. So this is something which is unhealthy diet. So by controlling this unhealthy diet, having the healthy food, fruits, vegetables, okay, the food which is very rich in proteins, okay, minerals, so all these healthy diet will help us to control our weight and eventually to control the obesity. So this is included under the modifiable risk factor. Then physical inactivity, okay, if you will see in the picture, poor diet and physical inactivity. Like, no, not at all there is a physical inactivity in nowadays lifestyle. Basically it goes into the sedentary lifestyle, like the lifestyle which is not involving at all exercise or bodily exercise. So this is physical inactivity. Or forget about the lifestyle, forget about the work culture, but again there is a laziness in the exercise in early morning and all. So all these factors are contributing to the physical activity, but we can modify them. That is the reason they are under the controllable or modifiable risk factor. Then use of alcohol, okay, smoking, we can prevent that. Hypertension, see, high blood pressure, again we can control it with the help of some medications or some lifestyle changes, okay. Then diabetes, hyperlipidemia, diabetes and hyperlipidemia, like high LDL, okay, low density lipoprotein, high cholesterol, then this diabetes, all these factors we can control through our, again through the exercise to some extent and through the medicines to some extent. So these are modifiable risk factors, as well as some infections like rheumatic heart diseases or HIV, like that, okay. So these are some modifiable risk factors. And some non-modifiable risk factors means what? We cannot change them, okay, they cannot be changed, but lifestyle modification जो होते हैं, like this here, in case of modifiable risk factors we can control them. Here we cannot control them, neither we can change them. So what are they? The sex is there, okay, age is there, race, family history. So we are going to go into the details in coming points, okay. If you will talk about the sex, generally it is observed that males are at a higher risk than the females, okay. If you will talk about the age, old age peoples are at the higher risk compared to the adults, okay. Then the race, if you'll talk about race or ethnicity, okay. So like basically BIPOC, that is black, indigenous and people of color, are at high risk complications than the American skin, okay. So this is about the race and the ethnicity. Then family history, okay, family history like genetics. Now you cannot change this. Age, you cannot control this, okay. Sex, you cannot change it. Race and ethnicity, you cannot change this. So these are under the non-modifiable risk factor, that is non-controllable risk factors, okay. So these are few of the risk factors wherein we will talk about this one by one. Age, as we have discussed, like growing age. With the growing age, increased risk is observed because of the damaged or narrowed arteries or weakening or thickened heart muscles, okay. Hypertrophy you can call it as. So with the age it prolongs, like with the age it what you can say, it increases. So men's around approximately above 45 and women's above 55, they are at a higher risk with the factor age. Then sex, males, again we have discussed, they are at a higher risk than the women, and for women's the risk increases after the menopause. Then family history, like a family history disease increases, your coronary artery disease, okay. This can be passed on from generations to generation, okay. Like here you can see, especially if a parent develop it at an early age before the age of 55, and like for males it is before the age 45. So or a male relative such as your brother or father, and 65 for a female relative such as your mother or sister. So there is a possibility which further can be carried out to the next generation. Then smoking again, nicotine का बहुत great effect is being observed on the blood vessel, since it tightens the blood vessel, okay. And because of the tightening and the carbon monoxide content, it can damage the linings of the blood vessel, and this becomes more susceptible to the atherosclerosis, that is atherosclerotic plaque formation, and heart attack is very commonly observed in the smokers compared to the non-smokers. Then poor diet, okay. Diet which is high in fat, salt, sugar and cholesterol. All these unhealthy diet factors can lead to development of heart disease. Again, diet like junk food, again which is high in cholesterol, high fat, okay. So but this we can modify, so this is modifiable factor. Then high BP, okay, because of the narrowing or hardening of your arteries, blood vessels, this condition arises, which again we can control. Then high blood cholesterol level, again this is the one cause is atherosclerotic plaque formation. And then the diabetes, again the persons which are suffering already from the diabetes, they are at the higher risk of heart diseases, okay. The similar risk factors are being observed like high BP, obesity, this will eventually lead to the heart diseases. Then physical inactivity, okay, lack of exercise, stress is also there, okay. Stress damages the arteries and worsens the risk factors. Then poor dental health, it is important to brush and floss your teeth and gums often, or regular dental checkups. If your teeth and gums are healthy, germs can enter your bloodstream and travel to your heart, causing endocarditis. So again this is a risk factor which you can observe because of the unhygienicity, uncleanliness, or not maintaining the oral hygiene. One can eventually lead to the inflammatory conditions of the heart, obesity, high weight, okay. But we can control it through the diet, like pear और एप्पल. पियर शेप में क्या होता है, हिप एंड थाई पे फैट डिपॉजिट होता है एज यू कैन सी इन द पिक्चर. एंड एप्पल में क्या होता है, जनरली चेस्ट और एब्डोमेन में फैट डिपॉजिट होता है. सो दीज आर द टू फॉर्म्स ऑफ ओबेसिटी, बट वी कैन कंट्रोल इट डेफिनेटली थ्रू द एक्सरसाइज एंड अवर डाइट. Then this are some like emerging risk factors, and these are the traditional risk factors, this which we have seen: hyperlipidemia, hypertension, diabetes, smoking, obesity, inactivity, and family history like genetics, okay. So this we have already discussed. And now what are the emerging risk factors? Basically, if you will talk about the stress which is observed in both males as well as females, okay. Depression, it is more prevalent in in women, which increases the risk of ischemic heart diseases, okay. Then menopause, early menopause may the lady is at the higher risk of developing the heart diseases. Then as the gestational diabetes is there, that is the diabetes which occurs in pregnancy, these females are at a higher risk of developing heart disease. Again, the same way as the gestational diabetes is there, gestational hypertension is there, that is hypertension in pregnancy, okay. Again, there is a risk of developing the heart disease with this gestational diabetes and gestational hypertension, okay, as well as this autoimmune disorders, okay, rheumatoid arthritis, etc. They elevate the risk of again the heart diseases as well as diabetes, okay. So this is the summary wherein we can see the modifiable risk factor, non-modifiable risk factors. Here we can see elevated blood pressure, like diet high in saturated fat, cholesterol, calories, okay. This eventually leads to increase in LDL, decrease in HDL, which is a good cholesterol, and LDL, which is a bad cholesterol, because of which eventually there is a elevated blood pressure, okay. So this we can control, but this increases with the older age or male gender, this we cannot control. So this is non-modifiable. Then tobacco smoking, alcohol consumption, all these things leads to elevated plasma triglyceride, hyperglycemia, okay. This physical inactivity leads to hyperglycemia, diabetes, or obesity, okay, this physical inactivity. So this we can control through the physical exercises and all. Then all these are the factors, okay. This lifestyle changes we can do, through which we can modify these factors, okay? Obesity, hypertension, diabetes, all these things, hyperlipidemia, this we can control. But we cannot control the age, gender, family history, okay, and the personal history of the coronary heart disease or cardiac heart disease. So this is about the summary. Then here we finish with the risk factors of the heart diseases, which we have seen. There are some controllable risk factors, that is modifiable risk factor, non-modifiable risk factors, and emerging risk factors nowadays, okay, with specifically in both males as well as females. So females may there are more emerging factors like gestational hypertension, gestational diabetes, along with the menopause, okay. So early menopause basically nowadays it is observed. So with this we finish with the risk factors. Thank you all, and stay tuned for the further videos from the same chapter, cardiovascular diseases, wherein we are going to cover the common types, like continuation with the risk factor, we are going to talk about the symptoms, prevention, which are common to every heart disease. So thank you all and stay tuned. Visit to our website www.pharmacyinfoline.com, wherein you have all pharma stuff. You will find the notes there, as well as current whatever are the issues with the pharma field. Then YouTube channel also we have. You can join us with the join button, wherein you will have the paid membership starting from ₹29 per month, as well as free access to all the videos for MCQs and various theory topics. Thank you.